lymphomas and nasopharyngeal cancer to apply the same techniques to the detection of herpes simplex virus, type 2 DNA, in cervical cancer biopsies and failed entirely to find it. So that really made me quite skeptic about the role of this virus in this type of cancer. And in view of the fact that I saw in a review which was published already in 1967 by Rosen and Mahy on the human wart virus, reporting a couple of anecdotal reports, or quoting them, that genital warts may occasionally convert into malignant tumors. The initial idea was if the virus causes occasionally malignant tumors at the external genital sites, maybe it reacts differently at the cervical site. It might be the responsible agent. Well, in the following years, we tried hard to isolate the virus, from genital warts, which turned out at that time quite difficult. And but the early studies, after isolation viruses from plantar warts, the so-called HPV1 right now, and trying to radioactively label this DNA and anneal it with DNA from genital warts, which in the electron microscope contained papillomavirus particles, was for us the first hint that the viruses in genital warts must be very different from the plantar wart viruses, in spite of a similar morphology. Now, in 1979 and 80, we were able, Lutz Giesmann and Michel Devilliers in particular, to isolate and clone and characterize the DNA of HPV6, the first genital isolate, and it was quite disappointing not to find this virus in cervical cancer biopsies. But with the aid of this virus, it was possible to isolate another related agent, HPV11, initially from laryngeal papillomatosis. And with this one, we have been somewhat more successful, because among 24 tested biopsies, one clearly contained, of cervical cancer, one clearly contained HPV11 DNA. And, but there were a number of faint bands in the same so-called southern blots, which we performed at this time, suggesting that there might be related but not identical viruses in these probes. And two of my former students, Matthias Durst and Michael Bossart, received the task to clone and to isolate those faint bands. Both of them have been quite successful, and indeed the first one turned out to be HPV16 and the second one HPV18 DNA. After having them isolated and after seeing that HPV16 was from the beginning present in about 50% of genital cancer,